Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about why it is important and necessary to absolutely replace missing first molars. Let's start. So this is a very personal episode to my heart because of the fact that there is a lot of scientific literature talking about single, unreplaced teeth and all those things. But let me talk to you about this one particular tooth that is the cornerstone in terms of guiding how your teeth bite and how your functioning of the mouth takes place, which is the first molar. All four first molars are absolutely necessary to be replaced after they've been lost either due to decay, extraction for any purposes, or any sort of periodontal disease leading to its loosening. So if you are an adult who's having even one missing molar tooth, it is absolutely necessary for you to replace that tooth, because teeth have a tendency to get displaced, drifted, tilted, or move into the position if they have the space. So for example, if you have one molar tooth, the first molar tooth, or any other tooth for that matter, molar tooth being unreplaced because it goes missing, the tooth number 5 and the tooth number 7, the premolar and the second molar, might shift into that space, altering how you bite. Now once this bite is altered, and this might take its good time, so that's why you might not notice the problems, but you will have other kind of problems. You might have problems in chewing, you might have problems when it comes to food getting stuck, which is known as food impaction and food lodgement. You might have problems such as periodontal problems. You might develop abscesses there, you might develop pockets there, and might have bleeding gums, and it can cause you pain and discomfort. On top of that, you have to understand that teeth are meant to be bit upon in a particular fashion. That means when you're chewing your food, the forces of mastication or chewing should fall perpendicular to the tooth surface. If the tooth is tilted for whatever reasons, the force will cause problems in the tooth, in its socket, and it might also lead to periodontal breakdown. That means that the bone might wither away slowly with time because of the fact that there is not adequate oral hygiene there, and that's where the tooth can not only tilt further, it can get loosened, and in some unfortunate cases it can also get fractured. So it's absolutely very necessary for you as a patient to take this responsibility. If you've lost any of your teeth, I'm not just quoting the first molars are absolutely necessary, but any particular single tooth, right, which is lost, needs to be replaced as soon as you are medically fit for it. And on top of that, this is known as basically bounded edentulous spaces, BES, right? So bounded edentulous spaces, the studies have shown, if you replace the teeth, the adjacent teeth, despite the fact that you are probably using a denture or an RPD an FPD or an implant, then the health of the adjacent teeth is also kept restored for a very much longer time than untreated cases. So this was today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. If you have any problems, just drop me a message on WhatsApp stating your name, your location, and your common oral health problem that's causing you pain and discomfort, and I'll get back to you on WhatsApp, via WhatsApp, in a couple of days. Kindly refrain from calling me as I might be busy with patients. If you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.